What are surgeons actually cutting through, and in what order? Why does the most critical moment of the entire procedure last less than 2 minutes? And what does your body do the moment it's all over? This is a cesarean section from the inside. The room is cold, not by accident, 18 degrees Celsius, deliberately, to slow bacterial growth and keep the surgical team alert under bright light. A woman lies on the table, a blue drape rising just below her chest. On the other side of that drape, she is awake. Within the next 10 minutes, a new human being will take its first breath. This is a cesarean section, and this is what actually happens, stage by stage. Stage 1, preparation. Before any incision, the body is made ready in a precise sequence. First, anesthesia. In most planned cesareans, this isn't general anesthesia. It's spinal or epidural, a needle placed carefully between two vertebrae in the lower back. Within minutes, everything below the chest goes numb, but the mind stays awake. Then, the sterile field. The abdomen is washed with an iodine or chlorhexidine solution, painted in slow, deliberate circles. Surgical drapes go up, isolating the only part of the body that matters for the next half hour, a small rectangle of skin just above the pubic bone. Think of it like sealing a room before painting it. Everything outside the work zone is protected. Everything inside is about to change. A catheter is placed to keep the bladder empty. It sits directly behind the area about to be cut, and an empty bladder means one less structure at risk. Stage 2, incision. The first cut is horizontal, low across the abdomen, what's called a fan and steel incision, roughly 10 to 15 centimeters long, following the natural crease of the lower belly. But one cut on the skin isn't one cut into the body. Underneath, there are layers, and the surgeon moves through each one differently. Skin first, then fat, then the fascia, a tough, fibrous sheet that wraps the abdominal muscles, often separated by hand rather than blade, pulled apart along its natural fibers like splitting a log along its grain. The muscles themselves are usually not cut, they're parted, pushed gently to either side. This is one of the reasons cesarean recovery, while still major surgery, doesn't involve a fully severed muscle wall. Beneath that, the peritoneum, a thin membrane sealing the abdominal cavity. Once it opens, the uterus comes into view, large, tense, and at this stage in pregnancy, the most active muscle in the body. Stage 3, delivery. The uterine incision is usually low and horizontal as well, made carefully to avoid the placenta and to leave the strongest possible scar for any future pregnancy. The moment the uterus opens, amniotic fluid is suctioned away immediately. Clarity matters now, because what happens in the next 60 to 90 seconds is the most time-sensitive part of the entire procedure. The surgeon's hand slides in, locates the baby's head or body, and delivers it through the incision, sometimes assisted by gentle upward pressure from an assistant at the top of the uterus, helping guide the baby down and out. This is the part most people picture when they think of a cesarean, but it's a small fraction of the total surgery, often under 2 minutes from uterine incision to the baby's first cry. The cord is clamped and cut. The placenta is delivered, manually separated from the uterine wall, and only then does the real work closing. Stage 4, closing. This stage takes longer than the delivery itself, often 20 to 40 minutes, as every layer that was opened closed, in reverse order and with precision. The uterus is sutured first, typically in 2 layers, using thread that the body will slowly absorb over weeks. This is the layer surgeons think about most carefully. Strength determines whether a future pregnancy carried safely. Then the fascia, that same fibrous sheet, is stitched back together. This layer matters enormously for long-term. A weak fascial closure is the main reason incisional hernias develop months. The skin is closed last, either with sutures, staples, or surgical glue, depending on the surgeon's preference. Throughout this stage, the anesthesia team is also working, monitoring blood pressure, blood loss, and the patient's reported sensations, since some pressure, though not pain, is still felt through the numbness. Stage 5, recovery. The drapes come down. The baby, already with its mother or under warming lights nearby, is being assessed. Heart rate, breathing, color, reflexes. For the mother, recovery starts immediately, but unfolds over weeks. The uterus, which just performed the most physically demanding work of pregnancy, must now contract back down to its original size, a process called involution, often felt as cramping for days afterward. The incision itself, all those layers sewn back together, will take about 6 weeks to reach baseline strength, though the deeper layers continue strengthening for months. What looks like a 40-minute procedure is, underneath, the body resetting from one of its most extreme physiological states back toward normal. Every layer cut was cut for a reason. Every layer closed was closed in a specific order by hands that have done this hundreds of times before. This is what happens inside the operating room. Watch Medicraft for more. Like, share, and subscribe for weekly updates.